All right. So look, the first thing is the difference between the different types of labiaplasty. Essentially, there are two major types of labiaplasty. And when I say labiaplasty, we are now talking about the inner labia or the inner lips. You know, the outer lips we sometimes operate on as well, but it's just not as common. All right, so I understand we're talking about the inner labia.
Yeah.
Now, probably the commonest, or I should say the oldest operation or the oldest method of reducing the labia is the trimming operation. And essentially what that involves is looking at the outside rim or edge of the labia and physically trimming it down so that we're shortening the length of the labia. All right. This is a relatively straightforward procedure that can be done under local anesthetic or under general. But as I say, it just involves the trimming or shortening of the edge.
Okay.
All right. Now, it's a simple and short operation, but it does have drawbacks. All right. The main drawbacks of this operation is that it puts the scar, or the stitches, and ultimately the scar on the very top of the labia.
Yeah.
All right. So in terms of visibility, it's just not a very well hidden scar. It's right on top of the labia, and it tends to sort of blunt the labia and doesn't make it look very natural. All right. So generally speaking, I don't prefer to do that operation. All right. It's still done commonly, but I think it has major drawbacks that make it unsuitable for a lot of women. All right. One other downside of doing that operation is that the trimming of the edge of the labia in fact cuts through all of the nerves that give you sensation in the labia and really in the whole genital region. All right. And cutting through the nerves, you know, creates the possibility of giving you painful scars in the labia. All right. Painful scars in the labia is potentially a serious complication because it can affect your sex life.
Yeah.
All right. So that's another reason I tend not to do that operation.
Okay.
All right. I'll show you exactly how it's done on a diagram in a minute, and also show you the type of result, the type of look that it can give you. All right. And you can kind of make up your mind whether it's something that you like or not really. All right. The other operation, or the alternative to the trimming, is what's called the wedge operation. All right. Now, the wedge operation removes the excess from the middle of the labia, and it actually preserves the natural-looking edge. All right. The other main advantage of this operation is that it puts the scar right into the fold between the outer and inner labia, so that the scar that this operation produces is virtually invisible. All right, so in terms of aesthetics and long-term looks, it's no question a superior operation. All right. And the third major advantage of the wedge operation is that it doesn't disturb the nerves to the labia nearly as much. All right, I tend to leave the nerves to the edge of the labia intact and undisturbed, so that it shouldn't interfere with your sensation, and it should decrease your risks of getting painful scars.
Okay.
And to date, I've performed several hundred of these operations, and I haven't had a single patient with long-term painful scars. All right, so that's obviously an important part of it.